patient-centered care for you?
Actually, for me, patient-centered care is how you take care of the patient, met or her physical, mental, and social needs, and treat a person like a patient as a person, not as just like a patient. So that's what I think when I take care of my patients.
Patient-centered care is, instead of going in, doing your vitals, setting them up for the breakfast, giving them their meds, taking your break, coming back, washing them, everybody at the assembly line. It's going in, maybe that one patient that you have wants to wash their face first, allowing them time to go to the bathroom, do their teeth for them, get them set up that way. Like, each person has different habits that they come with from home that they've had for a long, long time. And you want to keep that person in the same kind of safe and comfortable environment that they came from home, so things aren't so new and scary and intimidating.
It's very individualized. There's no one standard way of doing things. It should be tailored to every individual patient as much as the situation allows.
Person-centered care to me is just trying to find out more about the person and treat a person as, and realizing that they actually have their own interests and they have a life beyond being in hospital. And so trying to work with them and with the family to try and make their situation as positive as possible, and trying to work with them to try and see what we can do to make them feel like they're at home as much as possible.
Person-centered care for me means looking, interacting, and speaking with a patient through the patient's eyes. So mostly it means, to me personally, reserving our judgment and maybe reserving the judgment of our peers and really focusing on the patient and seeing what the patient needs at that time and in that moment.
Well, if you want me to put in one word, I will just say values. And I'll think about respect. And when you do that, it's like you focus on the patient's likes and what's important to them, and you base your care on that one.
To me, that means to treat an individual not based on their diagnosis, but based on them themselves, and to remember that just because you might have a group with dementia and have another group with Parkinson's, each individual is different.
To me, patient-centered care is holistic care and meeting the patient's needs and understanding and listening to the patient.
One thing more, we have to collaborate with other healthcare workers as regards to the needs of the patient in order for us to come up with the appropriate care.
And understanding the care plan or following the care plan. So as being a patient, they come for certain reasons, especially like their illnesses. So to summary for this is to concern for the dignity, the independence for the patient.
We are to the patients in a respectful manner and providing our best, like with the assessment, so that we know how to treat them.
How can I help him with his daily activity living, and so knowing that what is his ability, we can have a good relationship with the patient in our daily routine, and as much as we can let them do what they can before taking over all the things.
Patient-centered care means getting to know my patient in all aspects for me to deliver holistic care.
It means that I am there for my patient, make sure they are satisfied with the care I give them, and they're happy.